I want to thank all of our speakers. I think they've done a wonderful job of giving you both the medical picture, a look ahead to the future of what we might expect in our society as we see more of these conditions, the very important economic dimension, which relates directly to policy. And Melanie, I want to thank you again for sharing your rather harrowing story and putting all of us a little bit in that space of being able to identify with the condition. Something that occurred to me as Dr. Caro spoke is that our medical system is sort of episodic. You go see the doctor and she or he says, take this, you'll do that. And the aftershocks that come after an event like a stroke or atrial fibrillation, the impact of that on the cost just grow and grow and grow. And that's something that we need to keep in mind with all of these age-related chronic diseases. It's not just the single snapshot in the physician's office. It's going to be the lifelong impact and need for care, in some cases home care, in more severe cases long-term care. All of this is what's going to impact policy around healthcare. And the essential hope that some of these new treatments, new therapies are going to be able to help us avoid the worst of those is really the take-home message today. We're going to open it up for any questions from the floor. I'll make a few closing remarks, but all of our speakers, Dr. Caro, Ms. Long, Melanie, Sue, myself, please feel free. This is your time to dig a little deeper. Another question? Follow-up question? Well, seeing none, let me again thank our speakers. Thank you. I also want to let you know that this issue is too big in terms of public health and economic impact for it to go away after today and only exist on the Silver Book website, though I hope all of you, as you're helping your policymaker bosses understand the impact of this, will visit that site and draw from it, and it will continue to be refreshed. But also, while Dr. Caro said that there's no panaceas for combating thrombosis, we do have better tools. We have assessment tools of such things as bleeding risks. We have guidelines from professional societies that are very much trying to keep up with the technological developments that are taking place, the new drugs that you saw on those slides. And so we are forming a special task force on atrial fibrillation and thrombosis that will meet later this year and host an expert roundtable, especially to see if we can help develop some consensus around what works best and what is not working as well in terms of measuring risk, alleviating the risk, and looking at ways to better understand the impact of new treatments and how to assess who has the disease and how far along. I'm pleased to announce that the following organizations, in addition to the Alliance for Aging Research and AFib.org and the National Cardiovascular Nurses Association, we have already recruited to this ongoing task force the Anticoagulation Forum, Clot Care, the Heart Rhythm Society, Men's Health Network, National Forum for Heart Disease and Stroke Prevention, National Stroke Association, and the Society for Women's Health Research. So we're very pleased to have this group come together and believe that its work in helping to react to professional guidelines and assessment tools and helping to drive consensus in the field will go a long way toward helping us determine risk and guide the development, future development, maybe getting closer to that panacea, Dr. Caro, that we're looking for. Again, please go to silverbook.org, and if you want to go right to this issue, hit /thrombosis. And I want to especially thank our two partner organizations today, afib.org and the National Cardiovascular Nurses Association, and Daiichi Sankyo, our sponsoring partner, and also a tip of the hat to the Alliance staff that helped bring all this together, and we'll be working with that task force going forward. So thank you all very much for coming today, and I hope to see you again when we have the next volume of the Silver Book coming out. Thank you. Thanks to all of the speakers.